What's up YouTube? I'm Sasha. I'm a GP in training, currently practicing in Belgium, and I've been doing so for the last 6 months. And ever since I've started my practice here, I've been playing around with the idea of making a YouTube channel to explain what I think is some of the most important medical information that everyone should have a fundamental knowledge of in an easy to understand and very accessible way. You might be wondering what's the use in providing medical information online right now when there's an overabundance of medical information already out there. Well, in my personal experience, when I go online to look at some videos or information on medical topics, I usually find two types of videos. The first type is usually made by eccentric housewives, mainly telling people to use certain essential oils or not to get your kids vaccinated because it might make their arms fall off. The second type is a more scientifically valid video, but it usually does require some sort of previous medical or scientific knowledge and is therefore not easily accessible to the general public. And therefore my goal will be to explain some of the most important medical subjects in an easy to understand fashion, an easy to understand format for you guys, so that you can take a bigger hand, a bigger role in making joint decisions with your personal GP. More specifically, what can you guys expect from this channel? Firstly, I will be providing you guys with a lot of essential information. Secondly, I will be addressing some of the circulating fake medical news. There's a lot of it out there. And thirdly, I will definitely be answering your most important questions. So if you do have a question concerning any medical topic, post it in the comments below and I will get to it. Now, what will I not be doing on this channel? I don't intend to treat or diagnose anyone over the internet. The best person to treat you is your own personal GP who knows you the best after all. I've had to put those plans on hold though for the foreseeable future because another topic has taken precedence, the Corona crisis. I will in the coming weeks be addressing mostly what's going on in the world, medical news concerning the coronavirus, how bad it really is, and what we can expect in the foreseeable future. Now you may be wondering how the Corona crisis has affected me personally and other doctors in my country or internationally. Mainly, we don't get to see patients in our offices anymore because there's a risk of transmission there. So anyone with a runny nose, a cough, a sneeze, basically being human in winter, is not allowed to come to the office anymore. So we're mostly doing triage over phone, so functioning as sort of a call center. And when we are really concerned about our patients, we refer them to the triage post that's been set up as a specific response to this COVID crisis. 3 to 4 times a week, I myself am on call in these centers, basically seeing only people that are suspicious for COVID-19 disease. And we function as sort of an in-between between the GP office and the emergency room, triaging who needs to go in for further treatment and further diagnosing, perhaps imaging. Every week I'm expected to do at least 2 or 3 shifts. I'll be keeping you guys posted on what I see there, what's happening, the impression I get. Are we seeing more or less cases? For privacy reasons, I will not be allowed to film in there. Over the coming weeks, I fully expect myself to get symptomatic, to get sick. I'm trying my very best to stay as sterile and healthy as possible, not to get infected. However, there's a lot of reports coming in from young doctors and nurses, even in my immediate surroundings, now getting sick. So I think there's a real possibility of that happening. If it does, I will be keeping you guys posted on the disease progression within me. Let me know how you guys are filling in that quarantine time. Are you doing anything interesting? Leave a comment down below. If you like to follow me as a physician going through the next weeks of managing this COVID health crisis, please subscribe. It helps me to get this channel going. If you like the video, please hit the like button so that more people can find it. And if you have any questions that you'd like me to tackle or any suggestions for the channel, then please leave them in the comments below and I'll get back to you. Thanks for listening.